Welcome to our show, Ask Your Doctor. I am your host, Shivani Raj. For today's show, we have Dr. Apurv Agrawal. He is an oncologist and he has board certifications in medical oncology, internal medicine, hospice, and palliative care medicine. So Dr. Agarwal values patient education and shared decision making, which helps provide an individualized, evidence based treatment plan for all of his patients. So, without any further delay, let's welcome himself. Dr. Apu, welcome to our show.
Thank you, Shivani.
I hope you're doing well. First of all, Dr. Apu, we want to thank you for joining. A lot of South Asians watches our shows. So, without any further delay, can we get onto the show? And if possible, can you introduce yourself a little and talk about what you exactly do?
Sure. So my name is Apurv Agrawal. I am an oncologist and hematologist in New Jersey in the United States. I take care of patients that have any blood-related problems, blood cancer, or for that matter, any kind of cancer, and give them different treatments ranging from, some of the newer treatments like immunotherapy or targeted therapy. In some cases, some patients are receiving chemotherapy or hormone-based therapy to attack or hopefully kill their cancer.
Yes. So, Dr. Apurv, you yourself are an oncologist. So, what are your specialty treatments? So, can you talk a little about the special treatments that you provide personally to the patients out there?
Sure. So one of the cutting edge or newest treatment options in cancer care in oncology is a broad term called immunotherapy. So traditionally, we gave patients chemicals or chemotherapy with the intention of using those chemicals to destroy the cancer cells. More recently, the paradigm has shifted towards either alone or in combination with those chemotherapy drugs, giving what's called immunotherapy. What immunotherapy does is, instead of attacking the cancer directly, it actually stimulates a person's own immune system. So your immune system is activated and your own immune system is very active and participates in destroying the cancer. In some cases, patients can get this immunotherapy alone without any chemotherapy. In some cases, it's given along with chemotherapy. And this immunotherapy is used in multiple cancers, from certain types of breast cancer, lung cancer, melanoma, liver cancer, kidney cancer. So we're trying it in different spectrums of malignancies of cancer, and the results are better than we've seen from other treatments over the last many years.
Yes. So, doctor, can you just give a heads up about what cancers do you personally treat, and what are some blood disorders also that you treat in your clinic?
So I specialized or spent more time in my training to treat breast cancer and multiple myeloma, which is a form of blood cancer. But actively in my practice, I'm in the community. So essentially, I treat any cancer, any adult cancer. So I treat everything from lung, kidney, you name it, I treat it. And the same with blood. There are multiple types of blood cancers ranging from multiple myeloma, CLL, also called chronic lymphocytic leukemia, acute myeloid leukemia, chronic myelocytic leukemia. So as opposed to necessarily only seeing one type of cancer, which some doctors do, I'm a general hematologist oncologist, so I see all comers.
So, doctor, you yourself have been in the field of health for so long. What is the most common cancer that you basically see in your patients, or the patients come to you? And, maybe talk a little about your journey.
Sure. The most common cancers that I see in my practice tend to be lung cancer, breast cancer, and colon cancer. And it's not surprising because those are three of the cancers that in the US, but also internationally, are three of the most prevalent cancers. In terms of blood, I see a lot of myelodysplastic syndrome, which is a slowing of the bone marrow, or a form of leukemia called CLL, which is more commonly seen as patients get older. I had actually an interest in pursuing a career in pain management after my medical education, rather. And in doing a training program in pain management, I learned that I really derived a lot of satisfaction in interacting with the cancer patients. Unfortunately, a lot of them, because of their cancer, had a lot of pain, and that's why I was seeing them. So interacting with those patients made me change the direction of my career. So I first completed a general medicine training program for 3 years, and that was in New Jersey itself. And then I subsequently went to Boston for 4 additional years. And in Boston, I did my training in, hematology, which is blood disorders, oncology, which is cancer. And I also specialized in geriatric medicine, which is care of the elderly, because the prevalence of cancer is higher in the elderly people. So I did a specialization in the elderly population along with hematology oncology. After completing that, I stayed 1 extra year in my training. And at that time, I did a specialized training program in clinical trials. Clinical trials are basically testing new treatments on patients. So I learned the proper way to enroll and manage people on clinical trials. And that's a big part of what I do now. Besides administering the usual or standard of care treatments to my patients, in my practice, I offer a lot of clinical trials, which means the patients get access to the newer drugs that are being studied.
Yes. So, doctor, as an oncologist, you yourself see so many different kinds of patients. And I'm pretty sure, a lot of, let's just talk from a normal person's perspective.
Sure.
When they hear they have cancer, they're just very overwhelmed, and they get very scared and paranoid. So, of course, not a lot of people know that there are actually different kinds of cancers, different kinds of treatments, and not everybody dies. So personally, doctor, how do you deal with these kind of different patients now that you've been in this industry for so long? So what is the process? Because I'm pretty sure it's one of the toughest things to say to a patient that, oh my God, you have cancer. So how do you deal with that emotionally?
So I think there's two parts to your question. The first part is, I think that answers a little bit of both of what you said, is the importance of educating the patient. And by educating the patient, as you pointed out, to explain that there are different cancers, and your cancer started whether in the breast or the lung or the colon. That's number one. Number two is explain to them how much the cancer has spread or not spread. To be fair, it's in your breast, but it now may have spread to your liver and lung. The one thing I've learned, a lot of times patients misinterpret. They think they have breast and lung and liver. I said, no, it's one cancer. Unfortunately, it started in the same place. So I think education is key about the diagnosis, why you're giving them a particular treatment. So I earlier spoke about immunotherapy. If I recommend immunotherapy, I make a concerted effort to explain to them that because you have this kind of cancer, these studies that have been done show this is the benefit and these are the side effects that you can expect. And last but not least, to answer your question about the emotional part, I think the key thing as an individual is, as you said, it's very hard to have that conversation with a patient, especially when they have an advanced cancer or their prognosis is poor. But I think the key things for me in presenting that information is, A, to be honest. I think that's fair to the patient, not to mislead them about what the expectation is. B, to be compassionate. And the third thing is, people in life, in all walks of life, they have different things going on. So of course, I want to focus on the cancer and the treatment and the prognosis, but people have other concerns. What about my kids? I have something with my property. And I think I try to kind of cover to some degree their whole life and what's going on and what impact that'll have. And I think that often helps patients to feel that, we're connecting with them. And hopefully, in most cases, it makes them not feel better, but more comfortable and relaxed with their diagnosis.
Great. So, doctor, let's talk about breast cancer. Breast cancer, the topic of breast cancer, before 15 years was completely different, and now it's very different. People are now aware, what exactly breast cancer is, there are early treatments and symptoms also. I think it's, if I'm not wrong, it's been 15 years, and now people are getting aware about it. So, as a doctor, as an oncologist yourself, what are some things that people must know about breast cancer, and what are some early symptoms that women should find, before it leads to something else?
So I think the two key things about breast cancer, which are I don't want to say unique, but somewhat unique to breast cancer, which can be very helpful. So the key is, first of all, women obviously more commonly, but men can also get breast cancer. So I think an important part is a man or woman knows their anatomy, their body the best. So I think at least on a monthly basis, whether it's before showering, during showering, or after showering, a self palpation, examining your breasts on your own to see if you feel any lump or bump or something different. Is there any nipple discharge? I think that's helpful. But even more important, or maybe not more important, just as important is, luckily, if you look at it that way, luckily for breast cancer, they actually, unlike a lot of cancers, have a screening test. So I think for women to be very religious about undergoing their annual mammogram when appropriate is very important, because I think that obviously not 100%, but I think that a good number of patients that have breast cancer could potentially have been diagnosed earlier and had a less aggressive course if they were doing their self-examinations and the mammograms as recommended by their doctor. In most cases, that doctor might be their OBG.
So, doctor, in one of your broad certifications, it's something called as hospice and palliative care medicine. What exactly is that?
That's a good question. So, hospice and palliative care is basically symptom management, meaning besides having the cancer, that may come with certain symptoms, whether it's poor appetite or weight loss or pain or cough or trouble breathing. And that is a specialty that helps you manage those patients. Previously, there was a bad image or reputation. People thought if the doctor is talking about hospice or palliative care, that means that I'm dying. He just wants to make me comfortable. That's not necessarily true. A lot of studies have shown, even if you meet a newly diagnosed cancer patient, if you introduce palliative care to early in their course, they actually live longer. And that was a big study that was done in lung cancer. And the reason is they're more comfortable, their symptoms are better managed, that you can actually extend their life. To summarize, palliative care is symptom management related to a terminal diagnosis, and it doesn't have to be cancer. People who have bad heart disease, lung disease, kidney disease, dementia, it can be used for all of that. And hospice is kind of more of a general term where the patient is more close to end of life and you want to prioritize or focus their needs and symptoms and caring for them when they're in the last 6 months of life.
Can you explain a little about the difference between chemotherapy and immunotherapy? How different is that, and what are some points that a patient must know before they get into either one of it?
The chemotherapy and immunotherapy are both used to treat cancer. The mechanism of action, the way the drugs work is a bit different. Chemotherapy, typically through an IV, you are infusing chemicals. And the good and the bad of the chemotherapy is these chemicals are designed to destroy the cancer cells. Unfortunately, due to collateral damage, you see people lose their hair. It can affect their blood counts. It can cause nausea and vomiting. As effective as it is, it's associated with a great deal of side effects. And again, the example I can use is it's like trying to drop a bomb on the cancer. Now, every drug has some side effects. So even immunotherapy has side effects, but they're a little bit different than chemotherapy. And oftentimes, from a patient's perspective, better tolerated because there's typically not much nausea, vomiting, hair loss. So the patient generally feels better. Of course, it can affect your hormone levels and cause fatigue or diarrhea. There are some side effects, but generally the treatment is better tolerated. And in chemotherapy, I gave the example of it's almost like dropping a bomb. The immunotherapy is more targeted. It activates your immune system. So it's more of a targeted treatment. So typically there's less collateral damage, meaning other side effects caused by the treatment itself.
Yes. So, doctor, I think this is a very common question that I'm going to be asking you. But I think in general, why does, like in simple layman terms, can you explain why does exactly any type of cancer even occur? So let's just talk about breast cancer. Why do you think that's happening at a specific area? And is there any medical terms that a patient, a normal patient, or just some people must know and get educated about it?
So I think for breast cancer, for example, one of the most common kind of associated reasons it happens is definitely genetics. So unlike other, not unlike other cancers, but specifically to breast cancer, if a woman or man for that matter has a history of breast cancer in their family, grandmother, cousin, or someone, it definitely increases your risk. That's number one. Number two, for all cancers, a lot of studies are showing that it has to do with our, being overweight. Universally, people are heavier and gaining more weight. And a lot of studies are showing that for a lot of cancers, being heavier or gaining weight is associated with a higher risk of developing cancer. Also, in many cases, there are environmental causes, whether that's, pollution or exposure to certain toxins. And lastly, I think this goes hand in hand with the weight, being active, cardiovascular exercise. I don't mean heavy strength training, just regular walking, getting your heart rate up has been shown to decrease your risk of cancer and improve your outcomes if you have cancer. But to summarize, I think the big one has to do with genetics, environmental factors, and your weight.
Yes. So, doctor, are most of the cancers or maybe some of the cancers hereditary? So, is genetic genes anywhere related to any type of cancer in general?
There are. So there's certain cancers for which you can check. Breast cancer is the most common one. But nowadays, that technology has evolved so much that on my patients that have, either A, multiple generations of cancer, meaning grandfather, father, individual, so 3 generations of cancer, or if there's a patient that a brother, a sister, or a cousin had it, meaning same generation, I typically will order what's called hereditary cancer screening. It's a comprehensive profile that checks a number of genes to identify if there's any genetic component. Based on those results, I use that information to do 2 things. One is, A, if they have a genetic predisposition, depending on what kind of cancer it is, there's a discussion on what can be done to reduce the risk of getting another cancer for that patient, a different cancer. And also, typically, genetic counseling is offered where you sit with the patient, review their family history in detail, because oftentimes this information, this data, won't help the patient themselves, but especially if they have siblings or children, that information can be useful to be proactive in those relatives to see what can be done to minimize their risk of getting cancer.
Yes. So, doctor, when I was going through one of your services, when I was going through a website, I read something called as hereditary services or hereditary
Yep.
screening.
Right.
So, what exactly is that? What exactly is that?
Essentially, it's kind of what I just described. It's essentially pretty much what I just described, which is, asking patients questions to evaluate if they have a family risk. Again, that's typically based on their family history. The second thing is ordering their blood testing that can be done on those genetic molecules. And last but not least, giving them genetic counseling to benefit both them as well as their family members.
Yes. So, doctor, let's talk about lung cancer. And let's, can you explain a little about what exactly is lung cancer? Because I think it's common, yet again, not a lot of people are educated about it. So maybe
Sure.
can you talk a little about it?
Sure. So lung cancer, as most people may know or do know, is this, even today, the most common cause of lung cancer is cigarette smoking. There are other environmental factors as well. People in the area of high pollution can also have lung cancer. There are broadly 2 main types. There are many subtypes, but broadly 2 subtypes of lung cancer. One is called small cell lung cancer, which can typically be more aggressive and is most often always in smokers. The second is non-small cell lung cancer, which has different forms. Lung cancer also has evolved a lot in how you treat that. On the lung cancer itself, when you make a diagnosis, you can check for certain molecules, and we can target those molecules in the treatment. And I'll give you an example that's very relevant to your watchers, your viewers' population. So there are patients from Southeast Asia that get lung cancer that have never smoked in their life. And that sometimes can happen at a higher rate than other places. So there is one particular molecule. The name's not that important, but I'll tell you anyway. It's called EGFR. This is a mutation in lung cancer that's most commonly seen in Southeast Asian women who never smoked. So if these women who never smoked and they come to me, Indian, Chinese, Japanese, Filipino, I immediately test them for certain molecules. The one molecule that I mentioned, if they have that molecule, they don't need chemotherapy, they don't need immunotherapy. There's a pill that they can take that stops that molecule from causing the cancer to grow. So I think the important thing to know is obviously, smoking is a high risk factor for developing lung cancer. But it's important to know that just because you have lung cancer doesn't mean you're, only can have surgery. Lung cancer is one of the cancers where it's so detailed based on the location or the spread or the molecule that there may be a number of treatment options. But especially for our Indian viewers and our Indian population, it's important to know that if you have a cough or shortness of breath or weight loss, even if you never smoke, you should not ignore those symptoms because unfortunately that doesn't mean you don't have lung cancer.
Yes. So, doctor, you see a lot of different pie charts and news that we Indians are generally prone to more diabetes, diabetes health, and because of the some people call this unhealthy, some just don't. So we have a lot of rice, we have a lot of
Right.
like a lot of lactose. Are Indians more prone to cancer in general? Because as an oncologist yourself, you pretty much see different kinds of people around the world. So are generally Indians more prone to cancer in general? And if yes or no, you tell your opinion about it.
So number one, the most risk for Indians, unfortunately, even for the healthiest Indian, a big study came out. I'm not a cardiologist, but simply put, Indians, even if you don't smoke, you're not overweight, you don't have diabetes, we as Indians are very prone to heart disease. Number one, just by virtue of being Indian. And along with that, diabetes, as you said, which is in part definitely our diet. Now, in terms of cancer, it's interesting. Previously, I wasn't seeing, or there wasn't that much news about cancer in Indians. I think part of it had to do with the fact that it was underreported. People, just weren't getting checked that much. But recently, both in India and the US, there has been a spike in cancer diagnosis in Indian people. And again, I think it goes back to, as I mentioned a little bit earlier, weight, being overweight. Number two is environmental. Like, unfortunately, there's some places in India where pollution levels are very high now. And I think that environmental exposure to that pollution increases your risk of certain cancers like lung cancer. And number three, there's some data, but I'll say on the upfront, a little bit my bias is that I think globally we're all eating more processed foods than when we traditionally did. And there's some data to suggest that that has increased risk of cancer. When I visited India as a child, I'd go to my grandmother, nothing was processed. Milk, everything came fresh. There was no garbage, nothing. Now I go to India, just like America, everything you're getting, plastic bags. So I think there's some component for that, which again, there's limited data, but that's my bias.
Yes. So doctor, when people talk about cancer, they're just this one traditional treatment that they consider. It's called chemotherapy. Everybody's like, no, okay, you have to go through chemotherapy, and chemotherapy has a lot of different, they have their backsides also. They get more sick, stuff like that. So, what are some other non-traditional treatment ways that people must know? Or maybe can you educate the people, especially South Asians watching the show right now?
So some cancers are hormone based, meaning for some women with breast cancer or men with prostate cancer, they don't typically, a lot of times those patients don't even need chemotherapy. They can get, some hormone based therapy, which is typically either a pills or a shot, and it re-regulates the individual's hormone levels. I mentioned earlier how immunotherapy has become common, but besides immunotherapy, there are also what are called targeted drugs. Targeted drugs target a particular molecule in the cancer. So it is also can be an IV or an oral tablet. It's not chemotherapy. I think that's relevant in our Indian population because the amount of oral cancer, neck cancer in India is a little bit high. And I think those drugs are both very successful against those cancers. So that's very relevant to our patient population. And a general statement is, traditionally people thought of any treatment for a blood cancer or breast cancer, lung cancer to be some form of IV treatment. But a lot of the treatments are moving towards oral medications. And again, like I keep saying, all medications do have some potential for side effects, but I think mentally the patients feel happier or feel better when they're taking a oral medication as opposed to coming to the doctor's office for IV or an injection.
Yes. So doctor, as an oncologist yourself, can you maybe suggest a proper diet? I know this is not completely your
Yeah, sure.
subject, but as an oncologist in general, what is the perfect diet, especially South Asians watching the show? What are some steps or some routine changes that they can, put in their routine just to avoid or maybe be on the
Sure.
safe side in general?
So I think the couple of things I can say, the one thing is, which we Indians do very well, is green leafy vegetables because they have antioxidants, they're superfoods. The only problem is we tend to drench those green leafy vegetables in oil. So you need to reduce the oil, butter, ghee content to really maximize the benefit that we should be getting from all these green leafy vegetables we have in our diet. The second thing is us as Indians, I think, should work to potentially reduce our both fat intake. I mentioned the oil and ghee and butter, but also reducing our carbohydrate intake. In chapati, roti, paratha, rice, we tend to eat a lot of carbohydrates, and we need to replace some of that with protein. And a lot of my Indian patients say to me, but I'm vegetarian, how can I get more protein? But I say, maybe instead of having 2 or 3 rotis, you have 1 or 2 rotis, but eat more dal or chole because those things have protein in them. So I think low fat and increasing protein in our diet and maximizing the green leafy vegetables, which have a lot of antioxidant benefit.
Yes. So doctor, can you also talk a little, now that Corona has come, a lot of people are aware about, different kinds of, now people are more safe, they want to put their masks on, they want to get their steaming done. And, anything for better lung health in general as an oncologist?
So I think, again, number one always is smoking. And I think the new thing, people think it's better, but I still think it comes with inherent risks. Vaping has become very popular. And I think vaping has the potential to cause a lot of lung damage. Even if a general layman Googles it, and if you look at an X-ray or a CAT scan of people that vape, and you can see the impact on their lungs. So I think the big thing for the younger generation is to stay away from vaping. Second thing, I think, is vaping and cigarette smoking. I think those are the 2 most common things that, if everyone stopped or cut down, that would improve lung health dramatically.
Yes. And finally, doctor, is there anything that you want to say to the Sakshi viewers watching the show right now?
Thank you and your team for having me. This was great. I really enjoyed it. And I hope the viewers got something out of this as well. And I think the key is, whether you have diagnosis of heart disease or cancer, to stay positive, be prepared, go to the doctor with questions. Nowadays it's a double-edged sword. We have access to so much information, but go ready with some questions and take a family member, because sometimes I see patients are so shocked to receive some news, but sometimes it helps if you have, it doesn't have to be a relative, friend, cousin, somebody who can be there with you to kind of serve as a second set of ears for you.
Thank you so much, doctor, for joining on to our show. Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.